Good afternoon. Thank you once again for joining another First Friday Wellness webinar at here at the local. As you guys know, the Healthcare Ombudsperson's program is a joint venture between the state of New Jersey and CWA. The idea here is that you now have someone at your local that can provide you education and counseling on your health benefits. I'm here to help you resolve any issues you may have when engaging in health benefits, and continue to work collaboratively with other state entities to create better healthcare outcomes. And frankly, one of the biggest challenges folks across America have is finding quality, affordable mental health care, right? And so today I'm very honored, and we're pleased to have with us Michael Midgette, the Chief Growth Officer at Forge Health. Forge Health is a new vendor or new provider that the state has contracted with to provide members with that affordable, quality mental health care. And we've spoken about throughout the year a number of things that really deal with the physical, right? Our physical health. But we all know that, especially in some of the jobs that we do, how important mental health is, right? We service the state of New Jersey, the residents of New Jersey, and frankly, a lot of our jobs are quite, taxing on our mental health. And so I do encourage folks to seek out counseling when needed. Let's not, wait till the last moment or when things are too late, when we feel overwhelmed. But even if that's the case, I'm sure Forge Health has programs for us. And with that, I'm going to ask Michael to step in and talk about Forge Health and the service they offer to our members. Michael?
Yeah, absolutely. Abdul-Basit, thank you for welcoming us and allowing us to come speak today. Karina as well. We feel so fortunate to have the opportunity to serve members across the state of New Jersey, both within the New Jersey Department of Public Benefits and then more broadly. And we can get into all the specifics of Forge Health's clinical program, as well as what we've done to really partner across the state. But diving right into it, and feel free, we'll have time for any questions at the end if you have questions, or I'll leave my contact information so that you can reach out more privately if you have any questions after the presentation as well. But at its foundation, as I mentioned, we feel so fortunate to have partnered with the New Jersey Department of Public Benefits to expand access not just to behavioral health care, but to very comprehensive, high quality clinical care that's been demonstrated to be the superior clinical care in the state of New Jersey. And a couple things to highlight right as we dive into this is, as we've partnered with the state, we're expanding access. All of the care that is provided by Forge Health is 100% private and confidential. It's all completely customized to meet your goals, and it's an outpatient level of behavioral health care. So what that means, and we can dive right into it, is we, as I mentioned, serve the entire state. So whether you as an employee are using Horizon for your benefits, for example, or you have a loved one that is in need of care, a family member, somebody in the community, we pride ourselves on being in network with every major commercial insurance, as well as Medicare and Medicaid in the state of New Jersey, and partner with a number of organizations across the state. And that's because at our core, our mission is to expand access to effective and affordable outpatient behavioral health care. So we want to ensure that no matter who that individual is, we're able to effectively treat that person. And with that, our clinical programming, as I mentioned, is a robust set of programming that spans the continuum of outpatient behavioral health care. And what I mean by that is we provide individual therapy, screenings, counseling, outpatient groups that meet once a week on a variety of different topics, all the way to serving those individuals who need a more intensive level of care and intensive outpatient. And what that means is they are in our care typically for 3 to 5 days a week for about 3 hours at a time. So that program lasts anywhere from 6 to 8 weeks, depending on the needs of the individual. And what it allows you or a loved one to do is get that very high level of care while still staying home, staying in your community, and not having to go perhaps to an inpatient facility if indeed the level of care needed is that severe. And we provide that spectrum of care for those living with mental health, substance use, as well as co-occurring conditions when there is a challenge surrounding both mental health and substance use. And then finally, we have very specific programming for veterans, very specific programming for first responders, in which the groups that those individuals are a part of are limited to veterans and first responders. We want to ensure that all the populations that we serve feel comfortable sharing in the group setting everything that they are perhaps going through. And we're very thoughtful about the groups and individuals that you interact with or your loved one interacts with on that treatment journey. Going a little bit deeper into the programming that we provide, as I mentioned on the left, at anywhere from early intervention services through intensive outpatient. And then on the right side of the screen, getting a little bit more specific in the buckets that are within those is medication-assisted treatment for those who need that in parallel with therapy. We have individual counseling, family counseling, couples counseling. We also offer primary psychiatry, group counseling, and then specialized group counseling. And essentially what that means is, depending on the needs of the community, we have very specialized groups for those individuals. So for example, I'll take our Paramus, New Jersey location. They have a Pride at Forge group, which surrounds supporting those in the LGBTQ+ community. There's also have a Mothers in Recovery that's specific to those, as the name implies, mothers who are going through challenges relating to their mental health or substance use. And those groups are formed oftentimes by the individuals in therapy themselves, and facilitated by our clinicians based on the needs of that community at that time. Building on that a little bit more, an important note is that we have a hybrid, both telehealth and in-person model. So I'll get into our locations across New Jersey in just a minute, but we're committed and growing across the state of New Jersey so that any individual in need of care can make the decision alongside their clinician the setting of care that is most appropriate or preferred, whether it's telehealth or whether somebody prefers to be in person in one of our clinics. We want to be sure that we're not a provider that is limited to one or the other, so that the clinicians and the individuals in care have that ability to make that decision based on everything that is going on in their life. Seamless level of care transitions. For those of you who have experienced this or had a loved one experience this, one of the most difficult aspects of a behavioral healthcare journey is that many of the providers are very focused on a specific level of care, meaning a more intensive level or a more acute level, all the way down to just general ongoing therapy. And oftentimes an individual might have to move across from 2 to 3 to 4 therapists while they're going through their journey. At Forge Health, we believe strongly that it's important to maintain those relationships with clinicians that a person is partnering with throughout that journey. So whether you start an intensive outpatient and move to slightly something less acute, or you start in outpatient and you need something more intensive, you will maintain that clinical relationship with your therapist throughout your entire journey, no matter where that journey takes you. And those teams are multidisciplinary care teams. So this is not therapy in a silo with just one individual. There are teams of people to ensure that no matter what the individual needs are, we have the ability to build a comprehensive plan for that individual. So we have psychiatrists, psychologists, licensed clinical social workers, licensed professional counselors, care coordinators that support that individual depending on what you need. All of our clinicians are master's level clinicians, so they are all very, very good at what they do and the best in the industry. Building on that, working around our therapists, as I briefly mentioned, is our care coordination team. And they help individuals with everything that they need outside of the clinical therapy itself. meaning if somebody has housing insecurity, if somebody needs a primary care physician and they don't have a primary care physician, these care coordinators help ensure that everything going on that patient has access to and has a whole care plan built for them, built alongside them with the care coordinators, with the therapists, to ensure that outside of therapy, everything in that individual's life is in a good place so that they can be most effective while in therapy. And then finally, alumni programming. So we believe that and hope this to be a lifelong relationship with every client that we have the ability to partner with. And what that means is as that individual either graduates from our programming or starts to become less frequent, we have that alumni programming, we have alumni groups, we have an alumni newsletter, and we have a huge community of those who have gone through the Forge Health program that all lean on each other, that help each other, that stay friends ongoing. And it really is something that's very, very inspiring to see. Moving on, so as I mentioned, we have a growing footprint and zeroing in on the state of New Jersey, and I can send this out after the call. We currently have facilities in Paramus, in West Orange. In 2 weeks, we're opening facilities in Princeton and West Deptford. And then over the next 60 days, right behind those, we will have in-person facilities in Mahwah, in Toms River, and in Freehold as well. So we'll be up to 7 locations across the state of New Jersey. And as you can see, we also serve other states as well. So just across the border, we'll have clinics in Philadelphia and clinic in Langhorne, Pennsylvania, just a handful of miles inside the border from New Jersey. And then north, we have facilities, 2 on Long Island, 1 just north of the city in White Plains, New York, and then opening 1 in Queens in about a month. So if you have loved ones or you happen to live just across the border, we're able to provide our clinical product to you there as well. And then the last thing I just want to highlight is the results that our clients have been able to see while in our programming. As you can see on the left-hand side of the screen, these are clinical measurement scores, and you see significant improvement on those who have entered in our care. These are actually industry leading. Many of these studies were done by the state of New Jersey. And we have been able to demonstrate that again, our clinical programming is the best in the state, and that's a huge reason why the Department of Public Benefits selected Forge Health as the preferred behavioral healthcare provider for their employees. And then on the right-hand side, from the mouths of actual individuals who we work alongside. We pride ourselves on providing a superior patient experience, and are very proud of the fact that a huge percentage of the individuals that we work alongside have come via word of mouth, have come via referrals from individuals who have been in our care previously, and would encourage others to entrust themselves into Forge Health. So the last thing I will leave you with is if you or anyone at all is in need of care, never hesitate to reach out. We have a 24-hour commitment, meaning that if you or a loved one is in need of care, we can get them into care within 24 hours. The industry standard right now is about 6 weeks. So anybody that's reached out might be thinking, I've tried reaching out to other providers in the past, and I was told it was an 8-week wait list or a 3-month wait list or an indefinite wait list. We continue to grow. You saw our growth, and in large part, it is because we want to continue to deliver on this 24-hour commitment. And we understand that when somebody reaches out for help, it is we want to be able to provide that level of support as soon as possible. So if you need that support, if a loved one needs that support, you can reach us via this phone number or online. All you have to do is go in and put in your information or the information of a loved one, and we will reach out to them same day and begin the process of getting them into care. With that, Abdul-Basit, I'm happy to answer any questions if anybody has any. Otherwise, I really, really do appreciate the time today.
We don't have any questions at the moment yet, but if you have any questions, you can submit them in the chat to me or Abdul.
Thanks, Michael. I appreciate appreciate your presentation. I appreciate you being with us today to talk about, frankly, one of the most important health related matters that we have. Since there are no questions, I actually had one that I know people have mentioned in the past. Doing the being a staff rep, sometime you do come across mental health related matters. And I guess one thing you guys have the you told us the process. You have the phone numbers up here. So that answers a couple of questions. But I guess when someone's like in a moment of crisis, and I've dealt as a staff with some folks who are like, I guess trying to get affairs in order and like thinking the things they have to do and really creating mental barriers to getting the help they need, right? Like that's one of the things that people tend to do. Oh, my kids have school. Who's going to take care of them? One of the biggest things is money for most of us, right? And thankfully, we're in a union. CW negotiates really good leave time and whatnot. But when the person's like, going through this, is there assistance that you provide when it comes to like FMLA paperwork, notifying their employer that they're not going to be in for X number of weeks, that they need some time away from work, or does the person in the middle of crisis have to like handle all these administrative things on their own?
That's a great question. So we'll start it right from the beginning. So when they are in that moment of crisis, or a loved one's in a moment of crisis and they reach out to us, we have a team, and they make up our Access Center for Excellence. And essentially what this team is they're the ones that are there ready for anybody that reaches out to us. And for example, if you call on the phone, they're the ones that are answering the phone. And they will stay on the phone and help you through whatever you're going through, and help you navigate, whether it's to the care of Forge Health, or if it is truly a emergency. We're not an emergency service, but we will help you get to the resources that you need. We will stay on the phone with you until that support arrives, or until a loved one arrives. We will help in that moment of crisis, and really help facilitate everything that you need in that moment. And now once that individual enters our care or is scheduled for their first appointment, that's really where that care coordinator comes in. So you asked about paperwork, you asked about, notifying whether it's work or anybody else about an absence. That care coordinator is there to help with absolutely anything and everything that individual needs to be successful in treatment. So no matter what that is, that person is there as much as that individual needs them. And a woman by the name of Hannah Blank leads that effort across the entire state of New Jersey, and she has a team that helps folks in every corner of the state.
I appreciate you telling us about that, Michael, and I'm sure that would give folks some kind of ease of mind and not having to worry about additional things. If there are no other questions, I think we can wrap it up. Again, I do strongly encourage folks to, one, in general, let's stay healthy. And that includes not just the physical, but the mental. So I think all of us, especially doing the jobs we do, from time to time, should be seeing someone, speaking to a counselor or a therapist of some kind. Again, this is not just for folks in some kind of crisis, or, they do have general counseling for couples, individuals, families. Right. And again, we should all be doing that as a general matter for our mental well-being. And I do believe Forge Health will be, a huge value added to our members. Right. I remember he didn't speak about this unless I missed that. I apologize, Michael. But he did mention they are not inpatient. Right. They do everything up, but not including the inpatient care. And we had a member, reach out to Forge Health, a few months ago. And they relayed the story that, they reached out to Forge Health when they started going through the process, really quickly, within minutes of like getting on the phone. The intake individual at Forge, quickly realized that they needed something more than Forge Health could provide. They didn't just hang up the phone on them. They stayed with them. They looked up local nearby facilities that they can get the assistance that they needed. They helped call a loved one. had the person come, stayed on the phone until the loved one came home to them, and made sure that they were safe, as much as they can do from a phone, right? And the member was very thankful for the overall, treatment that they received, even though Forge didn't, actively provide treatment, didn't get paid. I think that speaks to the kind of quality care that we can expect. So with that, again, Michael, I appreciate you coming on and giving our members information. I'm sure it'll help someone. With that, just want to thank you all again for joining us for another First Friday Wellness webinar. As you guys know, when we close out, you will get a survey at the end to take. We appreciate your feedback. There's no membership meeting this month. It is December. So with that, happy holidays, everyone. See you in the new year. Take care.